The following video is a short presentation on how to document acquisition events for C19 case investigators. As outlined in your call script on pages 15 to 19, you'll be interviewing your cases for two different time frames. The first time frame is the time frame in the 14 days before the symptoms onset or the test date if they are asymptomatic. And the second one is the time frame after the symptoms onset or the test date. In this case, we'll be looking at the period, the 14 days before the symptoms onset or the test date if asymptomatic. And this is the time where when you're interviewing them, you'll be looking to look at your acquisition event. In other words, how is it most likely that this person acquired COVID-19? So in this case, you're going through the time period involved, and as you're looking at it and documenting it into FIMS, you'll be doing both risk factors and acquisition events. In our example, we're going to be looking at a travel-related acquisition event. So in this case, we're going to be looking at the call script. As I mentioned, the summary being on page 19. So in this particular case, it was not someone who has a contact or into a new or previously diagnosed case. So in this case, it would be no for the risk factors. But in the case of exposure, setting, location, other province in Canada, in this case, it's going to be a yes, as when you interviewed the client, they said they had a trip to Calgary for a funeral. They were gone, leaving by car, February the 2nd, traveling alone, and returned February the 5th. And this was in the time period in the 14 days before they had symptoms. And so this is the time period you're looking at for acquisition events. Where did they acquire this? In the case of outside Canada, it was no. Other risk factors were not asked as it's not in the script. They stated there was no known outbreak. They were not pregnant. And the underlying illness as per the script is not asked. So once you have done the risk factors, you've already done the symptoms as per the call script, and you're going to be saving here in the quick entry. So you're in the investigation quick entry. And now what you want to do is add acquisition events. You will find the acquisition events by scrolling down and going into exposure summary just below the risk factors. And in the exposure summary panel, there's two choices: exposure quick entry and exposure summary. You're going to be going into the exposure summary hyperlink, and this will bring you to the exposure summary page. In this case, you're entering an acquisition event, and acquisition events are only done for cases, as acquisition event just means how did they probably acquire the disease. So in this case, for the C19 case investigators, you're going to be using multiple AE entry. When you click on multiple AE entry, you'll be asked on this page, and you have the investigation in context and the client in context. You're asking for an exposure name. So in this case, as he traveled alone and went by car, this was not considered to be an exposure. However, he went to a funeral in Calgary. So the exposure name will be marking funeral. The acquisition date, the time they attended the funeral, was on February the 3rd. So the acquisition start date would be February the 3rd. Acquisition end date would be February the 3rd. The location name, as there's not a place to put in the multiple acquisition events an actual address. In this case, we're going to be putting the name of the church and the location of the church in the location name, as this has a text field that has enough room to put this in. So in this case, we're going to say that he attended a funeral at Calgary Church. And we'll put the address in there as well. So we're going to just make up an address, 42 Oak Avenue, Calgary. And we'll put in a postal code as well, in case they need to know what the exact location is always preferred. So there as well. In this case, we're going to choose the type as being a public facility. The setting would be a place of worship. And we're not going to be choosing an organization here at all. And the rest of the fields are not added. And you just click on add. You now have your acquisition event with all the information at the bottom. You can then add another acquisition event, and you can continue to add the acquisition events as needed. The second one, we're going to say it was a family gathering. The acquisition start and end date, it was the following day, so February the 4th. Acquisition end date, it only lasted 1 day, so it was the 4th to the 4th. The location's name, we're going to say Uncle Jack Voss, as the client's name is Voss's house. And we're going to give the actual address of the house. So in this case, we're going to say it's 23 Gray Street, Gary. And we'll put the postal code as well. As usual, as always, we want to have the most information we can on any of these acquisition events or exposure events. In this case, it's an acquisition event. It's where did they most likely acquire this disease. So the type of community contact would be community contact and close non-household. And then you would just click on add. So there you have the two situations where he might have had the acquisition, he might have acquired the disease. And we've also found out that he drove back to Winnipeg and he's been on isolation ever since. And this was the only 2 times that he went to any event during his 14 days before symptoms. So all you have to do now is click on save, and it will say acquisition event successfully saved. And then if you want to go and check on your investigation quick entry, you would see now, if you scroll down, there's been an acquisition, 2 acquisition events with the details added to the investigation quick entry, and you will also find it in the investigation summary. So that's it. That's a very easy way to enter acquisition events, not complicated. And if you look on your script on page 19, you will note that at this point, we are going to be putting in a staging. And according to page 19, if it was a close contact, there would not be an acquisition event needed that was a close contact with someone with COVID-19. If it was an outbreak or cluster related, you would create an acquisition event and it would be close contact in staging. In this case, it's client traveled prior to the communicable disease period. The staging would be travel acquired. you would create transmission event and add the risk factor details, which we did. So in this case, it's going to be travel acquired. The third example on page 19 of your call script would be if the client has not had contact with a confirmed case and setting and has not traveled. In that case, you would be choosing unknown acquisition. And in that case, you would be creating an acquisition event or events for any other related exposures where the person may have acquired the infection. If the client did not identify any possible acquisition event, you would be adding a clinical note. So that is the demonstration of adding acquisition events in FIMS. After you've done that, you click on Save, and you've completed that section up to page 19 in your call script. Thank you.